Press. Happy Doctors Day 2025. This is Dr. G at the Heart of Healthcare with another bonus episode 40 of season 2. We'll be starting season 3 soon, but we had to get this episode out for Doctor's Day with my hospice bestie, Dr. Lauren Templeton. She's here to help us celebrate. Happy Doctor's Day.
Happy Doctor's Day to you.
Thank you for everything you do. And let's tell the audience about this day. But first, the title of this episode is going to be Measuring the Value of a Hospice Physician, because we're hospice physicians, so we can talk about it. This is for individuals who want to be engaged in hospice. This is for the consumers who are looking for a hospice. And this is for just people in the industry. All right. So let's talk about Doctor's Day, though. So this year, the theme is Behind the Mask, Caring for Caregivers. Doctors dedicate their lives to caring for others, but who's looking out for them? National Doctors Day, we go beyond gratitude to action, championing the well-being of the healthcare heroes who keep us healthy. Behind every mask is a human being, one who deserves rest, recognition, and real support in the fight against burnout. What do you have to say about that?
Oh, I just feel it to my soul. That's a good thing to celebrate on Doctor's Day.
Yeah, people always, when we tell them what we do, they're like, "Oh, they melt." They probably wonder, "Oh, how do you do this? It's so hard." Any tips on how you restore yourself doing the work that we do?
I think I love the opportunity to get in the hard with people because then you actually get to feel the reward also. And so I just want to. It's easier to go day to day when you spend time to celebrate your wins. That's my biggest thing actually to avoid burnout because the healthcare industry is hard, and dealing with end of life care is just right up there. But when you take a moment to take a breath in and celebrate the really good stuff, the really good family meeting, the really good symptom management, a business thing that just seals the deal for your team, I think that goes a long way.
It does. It does. Well, thank you for all you do. Everyone here, let me just give a little quick bio about Dr. Templeton. She's a member of the Physician Council for the Pennant Group. She is the Weatherbee Resources Hospice Physician Consultant and multiple time guest of this podcast. We've talked about regulatory myths. We've talked about goals of care. We've talked about Christmas, and then the season finale with Judy Lund Person, we talked about the hope of hospice care. So thank you for always coming back to educate us.
Oh, it's super fun. I love being on this podcast.
It's fun. So yeah, recently we had a hospice medical director certification board webinar, and we're putting out great content for the hospice and palliative medicine fellows to come and our own community. And so we kind of got a little chatter going and realized we needed to get on here and talk about some things. So today we're going to talk about measuring the value of a hospice physician. So let's just jump in. So I want to say the story of the day I'm going to use as I had a potential client for Mourning, someone that I could help for their backup call. Here in California, we have so many hospice agencies, so sometimes they need a backup physician, someone who will actually answer the phone when the nurses call. And so I was talking to someone, kind of screening them, and they were complaining about their hospice medical director and sharing some of the challenges and asking me why this person does what they do. And I said, because you allowed it. It's very
Oh, and
simple.
that's a hard truth, isn't it?
Well, you're paying them. This is your agency. Um, we need to have standards, and there are
Mm.
standards. And so that's why they're doing it, because you don't have standards. So anyway, we're here to talk about the standards because um the non-clinical hospice agency owners, nothing against you, I welcome them. We have our friends, like Kevin, who have great agencies, But some of the people who are not knowledgeable, they compromise the clinical care we're obligated to provide through the conditions of participation and jeopardize the agency itself. So I want to first promote your hospice physician compliance conference coming up soon, right? That's on April, what, 18th?
18th, just about a month away, a few couple of weeks away now.
Yeah. So since, is that just for physicians or?
It's tailored for hospice physicians. So I created that with Weatherbee because I just found a lack of really good guidance for hospice physicians about things like we're going to talk about today, getting into the nitty gritty of regulations, but making it actionable, not just what you read in the Federal Registrar, but this is how we can be leaders and be successful and how we document this. So it's a very niche presentation, but it's really the foundation of being a good hospice physician. It's a day long. It's recorded for those busy hospice physicians who can't attend the whole day. And it's really designed for those hospice docs. Now, I think administrators could get a lot from it, but it really is tailored to hospice doctors.
I agree with you, because I posted some things recently on social media about, the USMLE Step 3. Like, why do we get a license so we can diagnose and treat? And Match Day, which was recently, a lot of people don't know what doctors do. They know we're there, but they do not know what we actually do. And I hope to unpack that. So I think it would be great for an administrator to go so they recognize the expectation instead of bringing someone on, throwing them a computer and expecting miraculous things, to be written on the CTI. So we're here to set the standard and help them understand, and hopefully you learn a lot from this. So let's just jump in. So we're going to categorize the topics today, like I said, with consumers, hospice agencies, and physicians who want to be engaged in hospice, because we welcome people joining the workforce. We need great physicians, primary care physicians who lead small agencies, or maybe an agency with a few, under 20 patients, and they could use a good physician. You want to comment on that?
Yeah, absolutely. I think we talk about hospice as a business is such a negative thing, and it can be. But at the end of the day, if you have a census of 20 to 25 patients, you're not dealing with a full-time physician that needs to be available. They're available, of course, all the time. But in terms of the actual workforce and answering the phone and doing the work that we need to do with the team, we need doctors that can do this as a part of their other careers. But the focus there is that it can actually be such a side gig that you don't care about it, that you don't have passion for hospice patients, and then also for doing your job well. And so they have to have enough time to do it that way. But we need those amazing physicians out across the country to stay engaged with us in these smaller hospice providers that are doing good work.
Amen, amen. And you fellows out there, we want you to be pure hospice physicians too. So, all right. So we'll start with the consumer and audience. Consider this as a continuation of the episode, How to Find the Best Hospice Agency, where we navigated the Hospice Compare website. So I'm going to just let you go with the metrics or the things that you know about that can help consumers, first of all, when they visit that website. What are some things they can look for on there? I think the hospice index, is that on there?
Yeah, the Hospice Care Index is a portion of carecompare.gov. It's the Hospice Care Index. It's the survey results. So when I say survey, I mean what our families that we've cared for their loved ones, what they're saying about our care. And then we look at hospice visits in the last days of life, which is a measure of how frequently we see patients when they're in those last days. We look at star ratings that are public. And so if I were a consumer, not a hospice physician, that is what I would look at, this data, to say, how do you compare amongst your peers, and how do you compare, or how do you show up in the eyes and opinions of family members?
Now, there's a lot of, agencies obviously in California. So some of them are young enough where they don't have data. Is there anything that a consumer can do when the data is not up? Maybe they can call, or what could they do to screen that
Yeah,
agency?
that is an unfortunate situation. I think that that's where really good hospices stand out with word of mouth. And so if I were in that position trying to find a good hospice, one, I would cold call the hospice because that's what's going to happen. You know, when you have an issue, you're going to contact the hospice, and I want to see how they communicate and how they prioritize a phone call. And so that's the first step. The second is talking to your primary care physician about what they've seen, who is their preferred provider, and why. Why are they your preferred provider? What makes them better than other members in the community? So I would start with getting information from those two sources.
That's fantastic. Okay. And then consumers, I'm sure you've seen a lot in the news, maybe. I've put some social media out there about the special focus program. You know, there's all this stuff that comes in the news. How can they get through these things?
Oh, that's a tough one to
I
say. So
know it's
we know
hard.
that special focus program actually was ceased, and that's because what we were hoping to find were the worst hospices across the country, and there were some issues with the data that maybe that wasn't the group that was actually represented with that list. And so I don't know that right now the way it is, even though it's ceased, gives us the information that we want. But when it comes back, and I'm assuming that it'll come back after they put so much effort into this, that may be something that would be helpful information for hospices for you to stay away from while they're figuring out how to do it better. I think that if a hospice is in the news for more than just really good things, you want to avoid that. I think just Googling a hospice and see what comes up with reviews. Now, people in dealing with end of life have a tendency to describe things in not the best light when you're suffering, and I understand that. So you want to look at more than just one review of a hospice. But look at what other people have to say, and certainly a good Google search is worth it in these days, unfortunately.
All right, all right. So we got the consumers. Do you want to talk about now hospice agencies internally or the engaged physicians? I'll let you kind of lead the flow of that.
If I could say one more thing about consumers, and that's the hospice visits in the last days of life when they talk about that percentage. So just so everybody knows, that's how many visits you get in those 3 days before your loved one passes away. We in the industry know that that is just such a tricky time, and we would expect good hospices to show up. And so when you see percentages, which the national average, the last time I looked, was about 49% of the time, you get a visit 2 out of the last 3 days. So that's really the toss of a coin. And so that's not good enough for me. For me to use that hospice, that's not the percentage I'm looking at. If you're looking up to 75, 80%, that is really what I would recommend a consumer look for in a hospice, because that means that they have processes in place to respond in hard times. No hospice is going to be 100% because it's not an exact science. Sometimes things happen out of the blue. Um, and so I wouldn't ever expect an A plus to indicate a good hospice, but I will be looking to be in the 80s club for as a consumer looking at those hospice visits in the last days of life. And then for your hospice care index, you're looking for nines and tens. Those are going to be your better hospices.
hmm Okay, well, let's get into the other stuff. So you were dropping bars during the webinar about the Pepper report, the Part D spending, Part B spending, long length of stay, all this stuff that can be affected by whether we're measuring the value of a hospice physician well. So let's just jump into it. I don't even know where to start. The audits, all the stuff. So kind of tell us how to measure the value of a hospice physician.
Yeah, I think this is where we have to have hard conversations. Again, I'll mention hospice as a business. Now, we don't like to talk about it that way as an industry, but it is something that has to be able to keep their doors open. So, when you are looking for a good hospice physician, or if an agency needs to be talked into the fact that they need an engaged hospice physician, we would look at what's the return on investment to having a good hospice physician. And so there's lots of data out there that can help a hospice guide themselves on, maybe we've gone astray and don't have an engaged doctor like we need, or this is the data that we need to look at in terms of focus on quality improvement with the physician that we have. So I would start with things like your PEPR report. Now, of course, PEPR is on pause, but hopefully it should be out in the beginning of April, as we would anticipate for 2025. It comes out on an annual basis for hospices. Within that PEPR report, we see data like Part B spending, which would be like physician services, sometimes DME, those types of things, and Part D spending, which is pharmacy going to Medicare Part D. And so those things are important for a hospice because if you're not covering the things that you're supposed to be covering, you're going to have a lot of spending in Part B and Part D. And to me, if I were a hospice physician looking at a hospice agency and they told me their data, I would back up and say, you have a lot of work to do. Are you willing to engage with me on doing the work, or are you happy with those types of numbers? Because that's not really indicative of good care. Now, there could be little things in play that cause some aberrancies in those numbers, but in the big picture, it is an indication of if you're covering the things that you need to be covering, and are you responding in a timely manner. So that's what I would look at in PEPR. The other thing there that is a good ROI on having a good physician is in your PEPR report, it talks to you about your length of stay. So in general, and for consumers too, the median length of stay for hospice is only 18 days. And it is varied by a day or two, but that's it for the last 20 years. And that's a shame to me because we want hospice patients to be on hospice a lot longer than 18 days, because then they get the full support of the entire interdisciplinary group. Then we get to know you and your wishes and your real goals. That's where the magic happens. And I know that might seem strange, but you really want to get to a point where you're a family member with your hospice team. And it's hard to do that
Mhm.
in 4 or 5 days. You're just not able to accomplish that. So that's one perspective. But then we talk about an average long length of stay. And so for hospices who have a problem with that, it may mean that you don't have an engaged physician who is deciding the hard decisions about, does this patient really have a life expectancy of less than 6 months? And that's important because these are human beings. We look at this as data, but these are people and they want to know if their prognosis is most likely less than 6 months or not. I mean, we can't forget that that's the fact that we're talking about. We get lost in the numbers there.
Mhm.
And so if you have a long average length of stay for patients, you probably have people on your hospice that shouldn't be, that don't have that life expectancy. Then it's probably impacting what kind of audits you get. You're much more likely to get audited if you have a average long length of stay. You might even be reaching your cap. For those who aren't familiar with the cap, it's much more complex than this, but the top reimbursement that a hospice can receive. And you don't really reach that unless you have a lot of patients with a long length of stay and not much of a case index mix. And so you need a more engaged hospice physician as your number one step for reaching your cap most frequently. In California, you guys are a little unique. Your reimbursement makes it a little bit more likely that you'll reach your cap, but still, we need to watch that long length of stay.
Hmm. This is good stuff. And let me just break that down in case we have people who don't know what we're talking about. Dr. Templeton and I have discussed goals of care conversation and how you get to hospice and come to these decisions. And so that's what she's talking about. Like, is this person really eligible? Sometimes people are doing poorly in a hospitalization, during a hospitalization, I should say, and they do appear to be, dying at that time, and then they stabilize or plateau in their decline once they're receiving hospice care, and then they may be discharged for extended prognosis. I don't say graduate anymore because some of our friends like Lisa Paul and Helen talked to us about how that's kind of, patronizing a little bit, and so I'm taking it out of my
Mhm.
vocabulary because people are left without care, and what are we doing with them? And so but sometimes when people don't die, they recover to a plateau, still having that terminal diagnosis, but they are discharged for extended prognosis because we're getting beyond the third, fourth, fifth benefit period. And so that's what Dr. Templeton is talking about. But you have to have a physician there to help you. And then also, you talked about relatedness. Sometimes people, we will simplify the med list so grandma's not full of pills. We talked about that in that episode. Those blood thinners, those anti-lipid medications, and some of those things. Well, covering it, is a hospice supposed to cover it, is it not supposed to cover it? I have a case right now where someone is you know receiving artificial nutrition, and so those are conversations that should be had before they come to the table. And so anyway, that's all the stuff we're talking about, but these are human beings who are dealing with the sacred time of life in their family. So okay, let's carry on. So let's see, where do we go next with all that data? So audits, those sound so scary. um, how do you show the value of your hospice physician as you get through audits?
Yeah, I think this is where my best story comes from my own return on investment from a previous hospice that I worked with. So we underwent a certain type of audit, and I want to be very clear: this isn't how all audits go, but for this type of audit, this is what happens. We got our results back; they were not good, not good at all. And we had the opportunity to sit down and have a conference with the reviewers. And so I'm in a conference room with the executive director, the director of nurses, and some other very valuable people in our hospice team. And then on the phone is this contractor, the one who performed the audit. And so we're walking through case by case by case. And for each one, I'm able to directly respond to say, I'm the physician that certified them as terminally ill. Furthermore, I'm the physician who saw that patient, and this is exactly what was happening. And when I saw the patient on March 1st, that's available for your review, XYZ happened, and that meant that this level of care was indicated. And I just went through case by case by case. And fortunately, they were very kind. And at the end of each one, they said, we'll take this into consideration and re-review this claim. And we were able to back our results down to almost perfect. And I mean, in that room, maybe for an hour, we're talking about a lot of money that was at stake here because it was a higher level of care. And our hospice deserved to receive that money. We provided very intense services for these beneficiaries. For example, we had already made that money and spent it on other hospice patients. This is what was called a post-payment review. And so in terms of an ROI, I really proved my worth. And so, if you don't have a physician with your hospice that's engaged enough to help you fight the fight, and unfortunately, auditing is just normal now for hospice. This isn't something that we're going to avoid, whether it's a new startup, whether it's a long length of stay issue, whether it's no issue at all, and you just receive this type of audit. Having a physician is so important to help you, one, avoid getting to audits, to respond to an audit. Maybe they write a summary letter to help give a written response to these contractors, or like me, they have the opportunity to respond in conference. Maybe you're able to do something that I do quite frequently now, which is expert witness testimony at the administrative law judge level of appeal. That's fancy for talking to a judge and testifying under oath. I have to raise my hands and everything to say that this hospice beneficiary was terminally ill, and the hospice did a great job, and they deserve to be paid for the services that they provided. And so, in terms of audits, you can't afford to not have an engaged physician, and this is the reality that we're in.
Amen to that. Because when I first, everyone knows I'm 6 years into my career in general, and as a pure hospice physician. And the first time I saw a bill of what someone had to pay back from the cap, I was like, why aren't we doing anything about it? I was so scared. And so I was like, let's get to work and see what we can do. And that was kind of how I created Mourning Dove, so I could be a mobile physician for people who just needed
Mhm.
home care. Home care is so important. And, shout out to the Alliance for Care at Home, bringing that marriage between all the organizations and home care in general. The non-medical home care agencies are so many everywhere, but just shout out to them for bringing that together. The bottom line is people need care at home, and there's no way we're going to be able to manage all these people in hospitals and, you know, the agency. It's just we got to come together. And so anyway, all that to say, um it's scary when the audits come and when the bills come. I can't imagine. I don't want to be a part of that side. So
Yeah,
thank you
but
for your
I love
stories.
it. Yeah, I love it though, because when you're a part of a good hospice that's providing good care, you can take pride in responding to these audits, like I was able to do. We did phenomenal work for these people, and they deserve to have a phenomenal provider.
Hmm.
And so, as a physician, you get to bring that lens to the table. And
Hmm.
so that's an incredible return on investment in engaged hospice physician.
Good. And I take pride in my CTIs. I always tell my teams, hey, when I sign this certification, I am ready to be on the witness stand. And that's as far as I want to go. So, all right. Well, I appreciate all the stuff that you kind of laid out. I'm going to put some like links in here. I don't know if, some of the business people, they may want to look into these things. I don't know what else we need to cover. I saw that in our notes when we were preparing, you were talking about acquisitions and all that stuff, PPEO. I don't even know what that alphabet soup is. So tell us about that.
Yeah, in today's reality, we have some acquisition movement, meaning hospices that are acquiring other hospices, significant amount. And so when you reside in 4 states, excuse me, California, don't mean to mispronounce your own state, California, Arizona, Nevada, and Texas, we're talking about enhanced oversight right now because they are watching more closely that are these business transactions or acquisitions of new hospices, is this a legitimate thing in the business of hospice, or is it not? Is it actually not providing good care to consumers and our hospice patients? And so if I was a hospice and I was making moves in terms of acquisitions, I would make sure that I had a doctor involved in due diligence, or at least one that is giving input on, is this a hospice that's doing the best that they can do? Maybe we can make them better, absolutely. But are they meeting the conditions of payment and the conditions for participation, which are rules? And sometimes it takes a physician's input there to be like, yeah, let's help acquire this hospice and help them grow and do a better work. And that's amazing. But you don't want to acquire a hospice that you're going to be enhanced oversight, which just means bigger auditing, a bigger auditing lens, and then get shut down because they weren't a good hospice. And you can't turn around a hospice overnight. And so in enhanced oversight, you don't have much time until you get audited. And so in the acquisition space, I think physicians are the unsung hero that can help you in your due diligence when you're making that type of business transaction.
Drop the mic. And there we measure the value of a hospice physician. So, the valuable resource today is the Hospice Medical Director Certification Board, of which we belong. Um, Make that is a way that you can ensure that your hospice physician understands the regulations that you may not understand, that or that they have access to a community where they can ask questions and have resources and education. And so I would highly recommend that you seek those type of physicians that have that, like us, and contact the board if you have any questions. That's a valuable resource. I'll let you have the last word, Dr. Templeton.
And you introduced this with my role with the Pennant Group, which is a member of the Physician Council. And so the Pennant Group is one of those businesses of hospice. They call themselves a leadership company that's taking care and providing life-changing service for human beings, which I love. That's the only type of hospice that I'm willing to affiliate with. But they have a physician council where they've developed this membership resource for other physicians throughout all of their hospices to be able to come, ask questions, talk about eligibility, talk about documentation. So I'm lucky I work with an organization that has that culture of excellence, leadership, and improvement. The HMDCB offers that culture for connection, webinars, and coffee chats if you're not lucky enough to work for my company, the Pennant Group. And so I just think it's such a valuable resource to, one, distinguish a hospice physician to say they know what they're doing. And the second is give them a place to not be siloed in their care. If they are doing this as a side gig, and I don't say that in a bad way, they need support. They need a place to go to say, hey, what's going on with this? And what's the latest with this? And where can I get reliable education? And how can I communicate with my peers? And the HMDCB offers that. It's such an incredible group that we're a part of.
All right. Well, thanks for being here. This is the end of season 2, the bonus episode 40, The Value of a Hospice Physician, right here with us. Happy Doctor's Day.
Thank you. Happy Doctor's Day to you. Thanks for letting me be on.
All right. Peace, everyone.